I do want to bring in Dr. Ashish Jha into this conversation. He is the director of the Harvard Global Health Institute. Dr. Jha, always a pleasure to have you on. Certainly on days like this when we're trying to make sense of what is the science behind this. The Oxford University phase 1 trial, seemingly significant. Are you as optimistic as researchers there are? And does this mean that we could possibly see a vaccine ready to go this year?
So, Eamon, thanks for having me on. This is good news. I think unequivocally, this is good news for two reasons. I mean, one is, as the researchers pointed out, pretty much everybody got an immune response from this vaccine. And then, there are two arms of your immune system, what we think about as humoral immunity, antibodies, and the second is cellular immunity, T cells. And I have to say, I'm pleasantly surprised, but this vaccine really does seem to stimulate both, and that really gives us that much more hope that we're going to have a vaccine that's going to be really effective against this virus. The timeline, I'm not as optimistic that we're going to have it sometime this fall, as I know some of the folks have brought up. I'm still looking at early 2021, but I would obviously love to be wrong about that.
How does something like this get scaled into production when you are now looking at a world map that literally has infections in every corner on this earth, and you have this company that's leading it, or this university, and we do know other companies like Moderna and others are working on their own trials. How does, from your perspective, something like this go from a university to being scaled to meet the demands around the world?
Right. So that's part of the challenge for why people who've sort of hoped that we can have a vaccine this fall, I think, are maybe being unrealistic. We've got to produce hundreds of millions, actually probably billions of doses of these vaccines. And, this is an adenovirus vector. So you have to take a virus and you have to modify it to get the right protein expressed. All doable. We have the technology, but to make billions of doses in a way that's safe and consistent, it's a lot of work. And there are a lot of places it could fall apart. So I think, again, great news, but I don't think we want to jump the gun here. Plus, it hasn't yet really shown that it prevents infection. What it has done is shown us that it generates immune response. We hope that that means it'll prevent infection, but that's what the next phase of the clinical trial has to do for us, is show us that.
Yeah, I was going to say, I may be thinking a few steps down the road here, but I'm watching how the mask debate has been politicized in this country. I can only imagine what will happen when vaccines are being rolled out and you have people say, take the vaccines, don't take the vaccines. How do you assure the public in this current climate that a vaccine that has some short-term positivity in fighting the coronavirus may not have long-term side effects? How do you even measure whether or not something like this could have a side effect 5, 10, 15 years down the line?
Yeah, so we probably won't be able to obviously do the study for 5, 10 years, but we know from other vaccines that you don't need studies that long. Most of the negative effects will become apparent much sooner than that. But this is why we need a large-scale phase 3, and I like the 30,000 people that they have set up in there that they're going to study in phase 3, and we've got to follow all those people. This is why, again, early fall is unrealistic because we just need the time to follow people to make sure they're not having adverse reactions to this vaccine. I think it's all doable. And again, I think early 21, I'm pretty optimistic we're going to have maybe this one or one of the other vaccines, but it's going to be hard to get it done before then.
All right, let me switch gears for a moment and talk about how we are currently handling the wave that we are in. Yesterday, NIH Director Francis Collins appeared in an exclusive interview on Meet the Press to talk about the country's struggle to get ahead of the virus. He pointed to New York and New Jersey and Connecticut as places that did a good job. That in of itself is questionable early on, but he admits that elsewhere the situation seems to have broken down. Listen to what he said.
Basically, steps were put in place, and if you look to see what's happening now in those areas, they came down very close to zero. But meanwhile, the rest of the country, perhaps imagining this was just a New York problem, kind of went about their business, didn't really pay that much attention to CDC's recommendations about the phases necessary to open up safely, and jumped over some of those hoops.
Should states like Florida and California, two red zone hotspots, be reverting back to a total shutdown like we saw here in New York early on?
Well, again, I'm going to go off of the White House's own guidelines that were leaked out last week. they're recommending that they certainly go back to phase one. And phase one is no gatherings greater than 10 people, no bars, no indoor dining. We really do need to pull way back in these states. And if we don't do that now, and by the way, and universal masking in these states, everybody needs to be wearing masks when they're outside. If we don't do those things, then we're going to be a step away from total shutdown, which many of us have been saying we really want to avoid. But I don't think that we can afford in these hotspots right now many of the things that are open that people are not taking seriously enough.
All right, Dr. Ashish Jha, thank you so much, covering a lot of grounds there this morning. I appreciate your time as always.
Thank you for checking out our YouTube channel. Why don't you subscribe? It's really easy. Just click on that button down there. And for more news from MSNBC, click on any of these videos here for the latest interviews and highlights. You can get more videos from MSNBC with our newsletters. Head over to msnbc.com/newsletters to sign up.